DHB is of course a powerful compound. You can definitely expect an increase in strength. It gives you that dry, hard look, and in the real world, its effects are very androgenic. Dihydroboldenone. It is one of the exotic anabolic steroids out there. It is well known for that dry, hard, grainy look on stage. Some bodybuilders swear by it, while others completely avoid it, as it is one of those compounds that we have a very limited data on, and with a lot of doubts around long-term health risks. So, in this video, we are going to break down everything you need to know about dihydroboldenone. We will talk about its history, dosages, benefits, and side effects. We will also cover important health concerns like its effects on the liver, kidneys, cholesterol, mental health, and more. And finally, we'll answer the big questions: is DHB worth using, and where does DHB actually fit into a steroid cycle? So, if you are a bodybuilder, athlete, or just someone who is curious about dihydroboldenone, this video will answer all the questions that you have about DHB. And now, let's get started with the history and medical usage of dihydroboldenone. Dihydroboldenone, also known as DHB, is the chemical name for the compound, but it also has another name, which is 1-testosterone. DHB is attached to the saponate ester, and the ester simply determines how quickly the drug starts working in the body and how long its effects will last. The half-life of DHB is about 8 to 10 days, which means you need to inject at least twice a week to keep stable hormone levels in the blood and to avoid potential side effects from hormonal fluctuations. DHB was originally synthesized before 1962. Some limited studies on rats were done on it back then, but it was never developed as a prescription drug. So it just stayed in the research books for decades until around 2002, when DHB suddenly popped up in the US supplement market. It was sold as a soft gels by supplement companies, and later it was also produced in transdermal gel form. But here is the thing: as we know, taking anabolic steroids orally, it is not a very efficient way, because the liver breaks them down very quickly and the steroid loses a lot of its potency. And to fix that problem, oral anabolic steroids are usually modified to become C17 alpha alkylated, which helps them survive the liver breakdown and deliver their effects. But that modification puts a lot of stress on the liver. But since DHB was marketed as a supplement, so you cannot do that, as it wasn't supposed to cause liver toxicity. There were a few unregulated supplement companies went a step further and made injectable DHB, which actually worked very well, but was very limited in supply. And just 3 years later, DHB was classified as an anabolic steroid, and all those companies had to stop producing it. To this day, DHB has never been approved as a prescription drug, and it has never been made by pharmaceutical companies. Right now, it is only produced by underground labs. And now, let's talk about the structure and characteristics of dihydroboldenone. DHB is derived from the hormone dihydrotestosterone, also known as DHT. But more specifically, it is a 5-alpha reduced hormone that comes from the anabolic hormone boldenone. Its chemical structure is also very similar to Primobolan. The anabolic androgenic ratio of DHB, it is 100 on the androgenic side and 200 on the anabolic side. Now, if you remember from our previous videos, all anabolic androgenic steroids are compared to the testosterone, which has a ratio of 100 to 100. But here is the important part. These ratios are based on lab experiments done on rats, and they don't translate 100% to real human use. Now, just to simplify this for you, when we hear the word androgenic, we think about potential side effects like acne, oily skin, aggression, increased body or facial hair. But when we hear anabolic, we think about muscle building, improved bone density, and repairing tissues. So on paper, DHB could build twice as much muscle as testosterone on a milligram to milligram basis. But again, that is only in theory. However, there was also a study done on rats. This study was comparison between DHB and testosterone propionate. Both groups were given the same dose, 1 milligram per kilogram of body weight per day. And in that study, the group that took testosterone actually built more muscle than the group that took dihydroboldenone. So, like I said before, we really should not take the anabolic androgenic ratio too seriously. It might look good on paper, but in the real world, results can be very different. And now, let's talk about the side effects of dihydroboldenone. DHB is classified as an anabolic steroid. However, its androgenic side effects are still very common, especially at higher doses. Things like increased oily skin and acne, more body hair growth, and even accelerated hair loss, especially if you already have a genetic predisposition for male pattern baldness. All these side effects can be expected. Some other androgenic side effects you may want to consider: DHB can cause insomnia in some people, and it may also increase aggression. I believe this because DHB has a strong activating effect on the CNS, very similar to DHT. So, if you are already someone who is sensitive to CNS stimulation, DHB might amplify that, which could affect your sleep quality or even your overall mood and behavior during the cycle. If you are thinking that using a 5-alpha reductase inhibitor like finasteride or dutasteride will help reduce those androgenic side effects, you would be completely wrong, because DHB is already 5-alpha reduced, which means the 5-alpha reductase enzyme does not metabolize it any further. So, those medications will not do anything to stop the androgenic side effects caused by DHB. Now, when it comes to estrogen-related side effects, DHB doesn't convert into estrogen. So, you don't need to worry about high estrogen-related side effects like fat accumulation, water retention, or gynecomastia. That means the muscle gains from DHB are typically dry, lean, and high quality, no puffiness or water retention. Regarding its effects on the liver, in the same study on rats that I have mentioned before, the testosterone propionate group showed no negative effects on the liver. However, the DHB group showed a significant increase in liver weight. Also, some users report elevated liver enzymes when using DHB. So, while we don't have enough data from human studies, we can expect that DHB might be liver toxic and can potentially raise liver enzymes significantly during a cycle. When it comes to kidney side effects, based on anecdotal reports, some users have seen elevated kidney values on blood work, which suggests that DHB might be renal toxic. But I also know some very experienced coaches that I really respect. They say they haven't seen any kidney issues with DHB use. So the truth is, there is no clear or solid information out there. Most of what we have, it is just personal experience and user feedback. Personally, I have never used DHB myself, and I have never used it with any of my clients either. But I do have a gut feeling that it could be very renal toxic. So, if you're ever considering using it, keep that in mind and monitor your kidney health closely. Before we move on to the next point, which is the effect of DHB on cardiovascular health, I need to mention something very important. YouTube doesn't really like to promote this type of content, so we may not see each other again. If you found value in this video, please like the video, subscribe to the channel, and hit the notification bell so you don't miss out on future content. And now, let's talk about the cardiovascular side effects of DHB. All anabolic steroids will have some level of negative impact on your cholesterol levels. They tend to decrease HDL, which is the good cholesterol, and increase LDL, which is your bad cholesterol. This shift in HDL to LDL ratio can raise the risk of cardiovascular disease. DHB, like all other injectables, does affect cholesterol, but it is not very harsh on lipids like oral steroids, which are the worst when it comes to harming your lipid profile. From what I have seen, injectables usually reduce HDL, but they don't raise LDL if your diet, body fat percentage, and cardio are on point. So it is highly recommended that you stay disciplined with your diet even during muscle building phases. Try to avoid all junk foods and unhealthy cheat meals. And make sure you are doing challenging cardio sessions. Personally, I find HIIT training to be very effective, both for heart health and time efficiency. This approach can help minimize the cardiovascular sites, which, by the way, are the #1 cause of death among bodybuilders. Also, make sure to check your blood pressure on a regular basis, and if needed, consider medications like ARBs or ACE inhibitors to keep your blood pressure under control. And now, let's talk about dihydroboldenone and testosterone suppression. DHB will suppress your natural testosterone production. Therefore, testosterone should always be used alongside DHB in any cycle, as testosterone is the primary male hormone that your body depends on to function properly. And when it gets suppressed, it also affects the production of other important hormones like estrogen and DHT. These hormones are very important for your body to function at its best, and they also play a big role in muscle building process. Now, by suppressing your natural testosterone, you will also end up with lower estrogen levels, and as a result, you will not get the most out of your cycle. You might even experience low estrogen side effects. These can include low libido, anxiety, and joint pain. That is why testosterone should always be the base of any cycle. Now, after using DHB, I highly recommend doing a proper PCT to help restore your natural testosterone production if you are planning to come off completely between cycles. But, in my opinion, going on TRT between cycles is the smarter move because it helps you avoid hormonal crashes and fluctuations. This way, you will be able to maintain your gains from cycle to cycle, and you don't have to deal with all the side effects of low testosterone. Let's now move to dihydroboldenone dosages and its application. As we mentioned previously, DHB was never approved for human use, which means there are no official prescription doses for any medical conditions. When it comes to its application among athletes, the most common dosage usually starts at 100 milligrams per week and go up to 600 milligrams per week. But in most cases, the sweet spot tends to be between 200 to 400 milligrams per week. So now, what can you really expect from DHB in terms of results? DHB is of course a powerful compound. You can definitely expect an increase in strength. It gives you that dry, hard look. And in the real world, its effects are very androgenic. But when it comes to muscle building, it is honestly not that impressive, even though the anabolic androgenic ratio says otherwise. So, in my opinion, DHB is best used during cutting phases or in the final weeks of contest prep to really bring that hard, dry, defined look on stage. Some people actually use it as a replacement for Primobolan, especially if they can't tolerate the side effects of Primobolan. But to be clear, Primobolan is much stronger compound overall. Personally, I don't see any real application for DHB during bulking or off-season phase. Let's move now to the availability and supply of DHB. DHB is only produced by underground labs. It mostly comes in 100 milligrams per milliliter concentration, but I need to mention this, DHB injections are very painful. So that is definitely something to consider before you decide to use it. Also, DHB is very often faked. Some labs may substitute it with testosterone or boldenone. In my opinion, DHB is one of those exotic compounds. We don't have enough solid data on it, and it has never been approved for human use. So, if you are considering DHB, now you know the pros and cons. Personally, I recommend staying away from the exotic compounds like DHB, mint, or superdrol, and sticking to the compounds that have been proven for decades with solid clinical data and predictable outcomes. So, if you are looking for better alternative for DHB, Primobolan or Masteron would be much better, and I have made a detailed videos on both of these compounds. So, if you want to learn more about Primobolan, click the video at the top of the screen, or if you are curious about Masteron, click the video down below.